I would say the first time I really thought about robotic surgery as a potential for veterinary medicine was maybe 6 years ago. It's quite an undertaking, and we're the first at Cornell to have a robot at the veterinary school. My reason for getting the robot was because I felt that we had kind of stalled a little bit with some of the minimally invasive surgeries we were able to perform with dogs and cats. We just couldn't go to that next level without this technology. I wanted to figure out, are there procedures that we can do that we're not doing now in a minimally invasive way for our pets? So many of these robots and these technologies have been tested on animals, and then animals don't get the benefit of it. So I really wanted to take back some of that technology for us.
When we got Finley, he was about 2.5 years old.
He was not doing very well in the shelter. The shelter, is great, but he was really skinny and he needed to go to a home environment as soon as possible. And so we were his foster parents until he could get the surgery that he needed.
Finley did have the first robotic gastropexy in the United States. It was doubly meaningful to us because he was a foster dog at the time, and so we were able to provide this procedure that he desperately needed, getting adopted by loving parents. It was just like a win-win for everybody, and we were so excited to be a part of that.
And we were so excited when we heard about, the type of procedure that he was going to get. A lot of Great Danes get gastropexies, but having this new technology involved is pretty exciting.
The difference is the elegance of the surgery is much better, and that does mean that there's less pain, less discomfort to the person or dog, right? To the patient.
It was the first time I've ever seen any robotic surgery in person too, so it was a really novel experience.
Just felt like it was kind of like a cornerstone moment for veterinary medicine, so really hit home for me. Like one of the reasons that veterinary medicine is so cool and really highlighted the way that we're pushing veterinary medicine to be better for our patients.
I think that robotics does have a place. Where that place is going to be, what procedures, I don't know yet, which is what I'm so excited to find out. R2 was really the first company that sat down and said, yes, we'd love to chat with you. We think this is amazing. These are $2 million instruments fresh out of the box, so to speak. And so that's why it's so important to gain contacts with companies who can kind of help us get our foot in the door with some of these refurbished instruments. I think if we can get the robot here full time, if we'll be able to train our students to use it, we'll be able to take care of those patients in the way that I think they should be cared for. And again, be pushing the limit of research to really figure it out. So it's going to be a process, but I can't imagine Cornell going backwards and not having the robot because again, it is coming, and we want to be a part of that beginning.